Procedural volume and auto-comfort transcatheter aortic-valve replacement. Definition. Transcatheter aortic-valve replacement is a minimally invasive procedure that replaces another aortic valve that cannot open properly, aortic valve stenosis. Aortic valve replaces why a transcatheter is sometimes called a transcatheter aortic valve implant.
Transcatheter aortic valve replacement procedure is performed on patients who have severe calcified aortic stenosis. And here you see an aortic valve that's not opening well. It's severely calcified and the leaflet motion is restricted. So to perform the TAVR or transcatheter procedure, a wire is inserted in the femoral artery. It is threaded up through the aorta and around the aortic arch. And then that wire is passed through the stenotic aortic valve and placed in the left ventricle. Following that, a balloon catheter is passed over the wire into the stenotic aortic valve around the aortic arch of the aortic valve. For the very first time, we can put this device in via a catheter. So for the very first time, a patient who needs an aortic valve replacement does not a great alternative. So this is really revolutionary. It's a game changer. It's going to change the way we think about our patients and the optimal approach to patients.
Application in nursing. Provide objective information related to diagnosis. Integrate patient instead using and reflection techniques. Create a patient source environment. Evaluate the patient to determine the medication response. Verify the permeability of the catheter in la vena. Check vital signs before and after administration. Inspect the surgical sites. Clean the area surrounding the incision. Task the patient to minimize tensions at the incision site.
TAVR, or transcatheter aortic valve replacement, is an incredible leap forward for patients who have aortic stenosis as another treatment option for them.
So the typical patient that is referred to us for TAVR will be an elderly patient, over the age of 70, let's say. Certainly we see patients with aortic stenosis who are younger than that, who have different reasons for having a blocked aortic valve. The aortic valve is the valve that leads away from the left ventricle, which is the body's main pumping chamber. It is the chamber of the heart that allows blood to be delivered to the body for all the needs that the body has. So usually over time in the elderly, in patients that have aortic stenosis, the valve calcifies, calcium builds up, and the valve
Still is surgical aortic valve replacement, in which a cardiac surgeon will open the chest, put the heart on standby on a machine. The act of putting the patient on the cardiopulmonary bypass machine is one of the very important attributes of open heart surgery, though it's also a very invasive part of open heart surgery. Transcatheter heart valve replacement does not need cardiopulmonary bypass procedure. This is a less invasive procedure in which we deliver a new heart valve while the heart is beating. So who's a candidate for transcatheter heart valve in 2017? There's been
Pros and cons. Aortic valve replacement and catheter can improve the lives of people with aortic valve stenosis. What cannot under surgery or unwanted surgery is too risky. This procedure can reduce the risk of death in these people. Aortic valve replacement, a catheter can also avoid the signs and symptoms of aortic valve stenosis and improve overall health.
of transcatheter aortic valve implantation. These are my disclosures. The PARTNER trial was the first clinical trial to demonstrate the efficacy of TAVR in both inoperable and high-risk populations. TAVR was associated with a significant decrease in overall mortality at 5 years compared to medical therapy, although survivors in this high-risk population was limited due to medical comorbidity, and high-risk patients on the right side and disabling stroke were shown to be comparable in groups receiving either therapy at 2 years.
Use applying in Ecuador. A.M. Eugenio Espejo Specialty Hospital, for example, 7 outtakes Procedural had a redundant big curve O. Alway excellent resulta. Francisco Ortega, ladder of TED angiography service and informed medical education. As indicated in the first procedure were performed in 2015. Omeware Tesla's 2 were done like we. Currently there are 4 more candidates who can benefit from the technique. Conclusion. The performance is enhanced in the current potent while aortic stenosis and valve percutaneous aortic is also most important since excellent performance is transcendental, setting the patient as a person and their vaccine. Clinical practice guidelines, including nursing staff within the surgical medical team, actively participate in the former during it after the implantation of the valves. It is necessary that as nurse will have contact with the type of intervention are familiar with the management of patient as well go to process.